Hi, I'm Dr. Rasagna, dermatologist and aesthetic specialist at Akkineni Hospitals, Vijayawada. Wishing you well. Today's discussion will cover important highlights. Please stay through and take note.
Hey everyone, welcome to this explainer. Today we're diving into something pretty much all of us have dealt with at some point, but honestly, very few of us actually understand. I'm talking about the life cycle of acne and the scars it leaves behind. We're going to zoom way in, looking at the microscopic origins of a single blemish, follow its entire journey, and really unpack its permanent aftermath on our skin. Let's get right into it.
If you've ever felt completely alone staring at a breakout in the mirror, listen to this. Up to 85% of people between the ages of 12 and 24 suffer from acne. 85%. It is a massively common, shared human experience, and frankly, a huge and growing number of adults are dealing with it well into their 30s and beyond. So, if you're battling breakouts right now, you are definitely in the overwhelming majority.
Okay, let's dive into this. Here is our roadmap for the explainer. We'll start by looking at why acne goes way beyond just pimples, then uncover the actual anatomy of how a blemish develops. After that, we'll cover the surprising triggers that make breakouts worse, how to match your treatment to the severity, and finally, how to erase acne scars and, better yet, prevent them from happening in the first place.
Section 1. Beyond just pimples. Why this is definitely not just a cosmetic issue. You know, acne carries a really profound psychological weight. It messes with self-esteem. It can change how we interact socially, and it can take a massive toll on our mental health. And here's the real kicker. Poorly treated acne doesn't just naturally fade away gracefully. No, if it's ignored, or if you just wait for it to resolve without the right intervention, it frequently leaves permanent marks, both physical and psychological, that stick around long after the active breakouts are gone. So this isn't just about getting clear skin. It's absolutely crucial for protecting your overall well-being. Moving right along, Section 2. The anatomy of acne. Let's look at how blemishes actually develop. Let's move to the microscopic level and see exactly how this builds. Every single pimple develops through 4 exact pathological steps. Step 1 is excess sebum production. Basically, your sebaceous glands go into overdrive and start pumping out way too much oil. Step 2 is follicular hyperkeratosis. That is just a really fancy way of saying dead skin cells shed abnormally, they clump together, and they essentially plug up the hair follicle. Step 3, bacteria enter the chat. A specific bacterium called Cutibacterium acnes absolutely thrives in this plugged, oily, oxygen-starved little trap. And finally, Step 4, inflammation. Your body's immune system spots this bacterial party, attacks it, and boom, that creates the redness and swelling we all know too well.
Now, depending on how intense that whole biological process is, you're going to end up with different types of lesions. At the milder end, you've got your comedones. Those are your standard open blackheads and closed whiteheads. When the inflammation really kicks in, that's when you get papules or pustules. But I really want to draw your attention to the severe types, nodules and cysts. These guys are large, they are deep, and they are firm. If you are dealing with deep cysts, you need to be incredibly careful. Why? Because these carry the absolute highest risk for permanent scarring.
Section 3. Triggers. Let's look at the everyday things that can worsen breakouts.
It turns out there's several scientifically backed triggers that can basically throw gasoline on the fire of an active breakout. Hormonal fluctuations? Massive factor, especially with conditions like PCOS or perimenstrual changes. Diet plays a big role too. Did you know high glycemic foods, and specifically skim milk, are heavily evidenced dietary triggers? Literally, skim milk. Stress is another huge culprit because elevated cortisol spikes your oil production. Then there's incorrect skincare. Sometimes people overwash, which strips the skin barrier and actually makes things so much worse. We also see certain medications like steroids or high doses of vitamin B12 causing issues. Oh, and here's a totally surprising fact. Mechanical pressure from just holding a phone against your cheek or wearing a tight chin strap can literally trigger breakouts just through friction. Wild, right?
Okay, Section 4, treatment by severity. It's all about escalating our therapies. Now, what's really interesting about tackling acne is how we match the treatment to the problem. Think of it like a strategic cheat sheet. As the acne gets more severe, our medical weapons have to get stronger. For mild cases, we usually just stick to the skin's surface with topicals, things like retinoids, benzoyl peroxide, or azelaic acid. But when we hit moderate acne, those topicals just aren't going to cut it alone. We have to introduce oral medications like antibiotics or hormonal therapies. And then, at the extreme end of the spectrum, for that severe deep nodulocystic acne we talked about, we have to deploy the heavy artillery.
And that heavy artillery is oral isotretinoin. This is arguably the most effective treatment we have for severe acne. I mean, it works by reducing sebum production by up to a staggering 90%, and it produces long-term remission in about 80% of patients. It's a real game changer. But power comes with responsibility. It requires strict medical monitoring because the side effects are no joke. We're talking extreme dryness, potential impacts on liver enzymes, and it is highly teratogenic, which means it can cause severe birth defects. So while it's wonderfully effective when managed right, it absolutely demands expert dermatological oversight.
Section 5. Erasing acne scars. What happens when the active breakouts finally stop?
So the crucial point to remember here, the golden rule of scarring really, is this. The more severe and prolonged the inflammation, the greater the destruction of dermal collagen. Remember those deep cysts we just talked about? That intense swelling isn't just happening on the surface. It is quite literally destroying the skin's structural foundation underneath.
And when that foundation gets damaged, it generally heals in one of two ways. First, you have atrophic scars, which means tissue is actually lost. These can look like narrow, deep V-shaped ice pick scars, or broad U-shaped boxcar scars, or even wave-like rolling scars. On the flip side, we have hypertrophic scars. This is where the body overcompensates and produces too much collagen during healing, resulting in raised tissue above the skin level. And we tend to see these more frequently in darker skin tones.
But don't lose hope, because advanced dermatology specifically targets these different scar types. For mild atrophic scars, we can see fantastic improvement with topical retinoids, chemical peels, and microneedling. But for moderate to severe tissue loss, we have to bring in the high-tech stuff, like fractional laser resurfacing. There's even this fascinating procedure called subcision, where a needle is actually passed under the skin to literally snap and break those tight fibrous bands that pull the skin down and create rolling scars. It's incredible. Now, for raised scars, the strategy flips entirely. We use things like corticosteroid injections to flatten that excess tissue back down. Finally, Section 6. Prevention. Why you absolutely shouldn't wait it out.
Which brings us to the ultimate question for this explainer. Can scarring be entirely prevented? I mean, is it really possible to go through an intense, active acne journey and come out the other side with a completely pristine canvas?
The answer is a resounding yes, but only if you take swift action. As the dermatology experts at Akkineni hospitals point out, acne is a medically treatable condition, not something to wait out. Early treatment prevents permanent scarring. Honestly, this is the single most important takeaway from our explainer today. If you or maybe someone you know is battling breakouts, please reject the age-old myth that it's just some phase you have to grin and endure. Early, effective intervention doesn't just clear up your current skin, it literally protects your future skin. So the question is, are you going to keep waiting it out, or are you ready to take control of your skin health today?